Obamacare is just beginning, and we're already seeing skyrocketing premiums, dozens of people losing their coverage, how about thousands? And our next guest says all you have to do is look at how veterans' health care is handled to see what the future holds for Obamacare, and it's not pretty. Captain Pete Hegseth is the CEO of Concerned Veterans for America. Now, you're still getting TRICARE because you're still active in the reserves in the National Guard.
Yep.
But if you were to retire, what do you get, and how is that like what we have?
Well, you get 5 years of coverage on VA automatically when you retire out of the military. What you see at VA are the same attributes we're seeing with Obamacare. You see, VA has spent $1 billion on technology, trying to bring the VA up to speed. It doesn't have a program that works. 97% of claims are still done on paper. We know we spent $600 million on healthcare.gov. When the government does technology, it does it poorly, nowhere near what the private sector can do. You also can't choose your doctor. Now, in VA, it's single payer. It's not the exact same as Obamacare. VA is single payer, no choice. Well, we've seen plenty of people who thought they could keep their insurance or keep their doctor Obamacare not be able to do that. A lot of the same attributes.
You know, on the radio show, I get a chance to get a lot of calls from Canada and even get some from France, and we talk about different policies. Now, if you have to go to a doctor, oftentimes they say, well, the doctor has to see me. That's good. Do you find that they're very backed up? When you talk to your buddies that used to be in the military, are they very backed up?
There have been a lot of stories about preventable deaths at VA facilities in places where there are wait times for diagnosis. So maybe they had cancer. If it had been diagnosed earlier, they would have prevented that death. We've seen more and more of that. And the problem is, if you live next to a great VA hospital, you're set. Then you've got good care and a good doctor. But if you live next to a poor facility, that's where you have to go. And there's a lot of places that have not delivered the kind of care they should, and there's no accountability. Nobody gets fired, and therefore the situation doesn't improve for those veterans.
Look at how backed up they are for this veterans. We have a full screen we just put together and talks about, look at the current claims. In the inventory of 685,931, claims waiting 125 days. That is 309. That's about half. 395,000 are waiting 125 plus days.
Yeah, it's absolute confusion. Think about the confusion around Obamacare. Do I have insurance? Do I not have insurance? How much is it going to cost me? Where do I get it? Same with veterans who are saying, I've filed this claim for my disability benefits. When is it coming? Am I ever going to see it? How much will it be? I call a 1-800 line. I wait with no answer. It's the same sort of confusion vets see that we're seeing with Obamacare.
And we're not saying it's apples to apples. There is some difference, but you do say this. When it comes from the government, there is a lot of frustration and there's a lot of delay because it's nobody's job.
There's no accountability, the same attributes. It's not apples to apples in the same exact system, but you don't have portability. There's no accountability. The technology is bad. There's no transparency. It's confusion, backlogs, wait times. No surprise. I mean, it immediately came to mind for veterans when we saw what was happening with Obamacare. Wow, those are the exact same things we're seeing with the Department of Veterans Affairs. When the government throws its the mix, it doesn't make things more efficient.
Yeah, and Captain, right now, would that be one of the reasons you stay in? Would healthcare be a reason why you'll stay active?
Well, TRICARE is a good system. I like the healthcare.
Much better than the veteran.
Well, it's not a reason to stay in per se, but it's a good benefit.
A lot of people stay in their jobs because they like the healthcare. Sure. A lot of people might stay in the military because TRICARE beats the heck out of the VA.
Beats the heck out of what the VA can provide right now. Now, again, some facilities are great. Some doctors are great. It's getting in the door to that doctor. It's the wait times and the confusion between you and your doctor. That's what we see with Obamacare.
Which the UK complains about, and Canada is beginning to complaining about.
That's exactly right.
Captain Pete Hegseth, thanks so much.
Thanks, Brian.
All right, good job. All right.